Hi, it's Jerry Tan, the acne doc. So you've been prescribed acne creams or gels by your physician for your acne, and you've been using it for a week or two. You're finding your skin getting dry, sensitive, maybe even irritated. What do you do? Here I'm going to explain to you my tips and tricks to help you get through those first 2 to 4 weeks of dry, irritated skin to lead you to greater ongoing consistent treatment for clear skin. So hang in, let's dive into it. Is your skin dry and irritated from acne treatments? Here are my tips on what to do. We know that a lot of the prescription medications that contain retinoids or that contain benzoyl peroxides, maybe even the topical fixed dose combinations containing the both of them, can be drying within the first 1 to 2 weeks of treatment, can also induce scaling, redness, stinging, and burning. So, what that means to us is that we're seeing barrier impairment and also skin irritation. And how can we reduce these side effects of irritation as well as dryness when you're starting treatment? Well, the first thing we wanted to do was to examine this question critically and scientifically. So we evaluated whether the product should be used every other night. Should we mandate the use of moisturizers? Should we also consider using limited contact, that is 3 hours per night, compared to the standard overnight use, which is what is the way it's done in the clinical research studies for approval by the United States FDA. So this study was done and then published in 2018, and here's what we found, which is the lowest risk of intolerability was when we mandated the use of moisturizers and when we used every other night applications. Shorter contact as well as standard overnight led to the highest rates of intolerability. So the first tip is to mandate the use of gentle cleansers and moisturizers. And number two is less frequent use for the first 2 to 4 weeks until we get to the more normalized part that we can then move on to every night application, at which point at week 12, we don't lose any issues with how well the medication works. So my tip is to start low, go slow. Start low whenever there are topical retinoids in your medicated prescription creams or benzoyl peroxide or fixed dose combinations containing either of those products. The gentle cleanser should contain no acne actives, and what that means is no benzoyl peroxide, no lactic acid, salicylic acid, and start slow, 2 to 3 times a week for the first 2 weeks, and then escalate the frequency as the skin is increasingly well tolerated to it. You can also start with dinner to bedtime application if the skin is very sensitive. And if that's the case, then rinse off the product before sleep time or sooner if your skin feels irritated or excessively dry, and then apply moisturizers. Start low, that is, dilute with moisturizer. And what you can do is you can apply moisturizer after cleansing, and then the medication, and then more moisturizer. That would be a 2 to 1 moisturizer to active, or what I call a closed face sandwich. And that's usually what we do with, we have patients with very, very sensitive, easily irritated skin. For most patients, though, who have fairly well tolerated products and they know that their skin is fairly kind of robust and not particularly easily irritated, we can start with an open face sandwich. And what that means is 1 to 1, which is after cleansing, you apply either moisturizer or medication and then the other products. So, for example, it might be cleanser, medication, and then a layer of the moisturizer. And over 2 weeks, if that is progressively nicely tolerated, then you can escalate the treatment to eventual full strength use. Here are the skincare ingredients to avoid if you have sensitive skin. Check your cleansers and moisturizers for ingredients that contain benzoyl peroxide, salicylic acid, lactic, glycolic acid, citric or ascorbic acid. The latter is very commonly used these days because it is an antioxidant. So, however, if you have sensitive skin, it can be really irritating to the skin. We don't really want to have any retinols or retinaldehyde in your skincare products because they should be there to be very gentle when you're using prescription topicals or creams that might be irritating by themselves. So you don't want additional issues with your skincare products themselves. Products that contain alcohols, abrasive particles, and then fragrances and essential oils. These latter can lead to contact dermatitis, where it can present as itching that is persistent and progressively worsening every time you use these products. So that might be not simply irritation, it might be actually a contact allergy. There are many brands with gentle cleansers and moisturizers from Avène, Aveeno, Cetaphil, CeraVe, La Roche-Posay, and Vichy, amongst many others. Consider acne treatments that are less drying, less irritating. And for example, with prescription medicated creams and gels, clascoterone cream, azelaic acid gel, dapsone gel, ketoconazole cream is much less likely to dry and irritate the skin. They still can in some patients. So we always still recommend gentle cleansers and moisturizers, but less likely than products that contain benzoyl peroxide and retinoids. Pills, because we avoid direct application on the skin surface like antibiotic pills, spironolactone, or oral contraceptives, are much less likely to cause dryness and irritation on the skin. My last tip is you can always combine the gentle skincare with less frequent use and then using treatments that are less drying and irritating. I hope those were helpful for you. If you have comments or questions, or you'd like to hear about future topics on acne, feel free to leave them in the comments below. I'd be happy to hear from you. Thank you.